makes you so sick at heart that you can't take part. You can't even passively take part.
We now have some very early data on Omicron in South Africa, and it's giving us a very incomplete picture of what this new variant is all about. But I think it's fair to say that it does offer some glimmer of hope and also of potential worries. And to quote the great HBO series Chernobyl, it's not great, but it's also not terrible. So I'm gonna start by showing a thread on Twitter from Trevor Bedford, and he works for the Fred Hutch. It's a research institute, but he made a very good thread on some of the South Africa numbers, and we're gonna read some of the main points here. So yeah, so thankfully we're in a situation where we can compare both Omicron and Delta, which both kind of coexist right now in South Africa, although Delta is being very quickly driven out, and we'll see why. So let's go to yeah. So the first thing that we want to know is what are the R values of this new variant, and there's two separate R values that we usually use. We use R naught or R0 and RT. Now the difference between the two is R naught is the one that we're probably most familiar with, and that refers to kind of the natural capacity of a disease to spread, or rather a virus or any other pathogen. Now this assumes R naught always assumes a condition in which there are no social distancing measures, no lockdowns, no vaccine protection, etc. So it really tells you like what is the natural capacity of that virus to spread. On the other hand, RT refers to the R value at a certain point in time. So right now, at this moment, the R number, which tells you how many people. So the R number, for those who are unfamiliar with the term itself, is for every person who catches this virus, how many more it's going to spread to. So an R value of 2 would mean that everyone who catches it will spread it to 2 other people. So basically what you want to contain a pandemic is to have the RT under 1, because that means you're transmitting it to, on average, to less than 1 person. So what are the estimates for Omicron right now? Well, anything from, at least in Gauteng province or state, whatever it is. Apologies to South Africans. I'm unfamiliar with your territorial structures. 2.5 and 3 at the end of November. Now, this is this chart is not new. This shows like the previous variants in the US and how quickly they've spread or not. And purple one is Delta. So you can see the slope is quite pronounced relative to other ones, and the gray one is the ancestral strain, as in old school COVID, and that one's pretty much kind of disappearing. And this same kind of chart is being used now here for different regions of South Africa, and you can see in Gauteng, it's just, yeah, it's a massive slope. So it's rising at a very fast rate, slightly faster than when Delta first hit. So there is reason to suggest that it is considerably more transmissible than Delta. Now, the question is just how much more? So the original estimates of so on average, I mean, different studies say different things, but roughly speaking, the R naught of Delta, the consensus is that it's around 6, the R naught. Whereas the ancestral strain of COVID was around close to 3, so 2.5-ish. So this shows just how big the transmission advantage of different variants have been relative to the ancestral strain. You can see Delta has a pretty impressive advantage of transmission versus the previous ones. So just how much does Omicron compare to Delta? Well, there you go. So that is Currently, the Delta RT is around 0.8. Omicron is around 3.8. So remember, this is at the same moment in time with people with the same average vaccination rates, same levels of previous immunity, and it's still 3.8 times on average more transmissible than Delta. So that is frightening. That is absolutely frightening. Yeah, another estimate around 4, RT of 4. Yeah, so he basically gives the ballpark figure for RT of between 3 and 3.5. And yeah. Now there's two elements that influence the R value, and that is, well, A, how naturally transmissible it is, so that would be the R naught, but also how much does it escape vaccine protection. So you can have, for example, a vaccine that has a lower R naught than Delta, but is still more transmissible because it evades vaccine protection much easier. Or when I say vaccine, I mean like previous immunity as well. Actually, for anything I've said right now involves mostly previous immunity, unknown whether this refers to vaccines or not. We still don't know just how effective the vaccines are. But so this chart basically gives it the range of possible options where Omicron can sit. So if it turns out that it does have an R naught much larger than Delta, then it's vaccine, its immunity escape is not as bad. So for example, if it had an R naught of 9, its vaccine escape would be around 20-ish. Whereas if it had an R naught of 3, then it would have a vaccine escape of around 83%, which means pretty ineffective, at least for transmission. Remember, this is just transmission. This does not mean that you are going to die just because it has an 80+ vaccine escape. So now that we know kind of the nature of the transmission of this variant, I think it's reasonable to conclude, and I suspect the data that's going to come out in the next couple of days will confirm that Omicron is significantly more transmissible than Delta. Now, why is this not necessarily a bad thing? Well, because, as it turns out, we also now have some early data from mortality and severe disease. And as it turns out, and this is really I would say the blessing in disguise, is that, or maybe not in disguise, just the blessing is that Omicron apparently is milder than Delta. So what's the evidence here? So this is data only from Gauteng province. So it is a province, I got it right. And I will show you. So this is a very small sample, a very small one. So we can't really make definitive conclusions on the severity of Omicron based on this. But still, some data is better than no data, right? And what does it say here? So there were a total of 42 patients who were studied in a hospital in a ward on December 2nd, 2021. Reveals that 29 of them, 70%, are not oxygen dependent. So they were in a hospital, but were not receiving supplemental oxygen. The patients were saturating well on room air and do not present with any respiratory symptoms. These are the patients that we would call incidental COVID admissions, having had another medical or surgical reason for admission. 13 patients are dependent on supplemental oxygen, of which 9 have a diagnosis of COVID-19 pneumonia based on a combination of symptoms, clinical signs, CXR, and inflammatory markers. All are being prescribed steroids as the mainstay of therapy. Not horse dewormers, as certain pundits claim. The remaining 4 patients are on oxygen for other medical reasons. Yeah. So two on previously on home oxygen, 1 heart failure, 1 pneumocystis pneumonia. This is really the kicker here. This is a picture that has not been seen in previous waves. In the beginning of all 3 previous waves and throughout the course of these waves, there has always been only a sprinkling of patients on room air in the COVID ward, and these patients have usually been in the recovery phase, waiting for the resolution of a comorbidity prior to discharge. The COVID ward was recognizable by the majority of patients being on some form of oxygen supplementation, with the incessant sound of high-flow nasal oxygen machines or beeping ventilator alarms. There are only 4 patients in this 42 patient cohort in high care and only one in the ICU. The number of patients in high care are on double oxygen, high flow nasal oxygen, or non-invasive ventilation were noticeably higher in previous waves. This is anecdotal but confirmed by numerous clinicians who have previously worked in the COVID wards in the hospital complex. Now here's more good news. Of 38 adults in the COVID wards on 2 December 2021, 6 were vaccinated, 24 were unvaccinated, and 8 had unknown vaccination status. Of 9 patients with COVID pneumonia, 8 are unvaccinated, 1 is a child. Only a single patient on oxygen was fully vaccinated, but the reason for oxygen was chronic obstructive pulmonary disease. So basically, only 1 vaccinated person needed oxygen. This is really good. And also, the fact that 24 of these people were unvaccinated and still didn't present, most of them didn't present a severe clinical picture. I think this is really good news. Really, really good news. It does seem to suggest that the vaccines are working. People who have been vaccinated, or maybe they had some previous, for these 24 unvaccinated, we don't know if some of them had already caught the disease. Maybe they have some degree of natural immunity already. But the fact is, they seem to work. Again, this is a very, very, very small sample. I'm an economist. I know a thing or two about statistics, and you would not make a final judgment on a sample of just 42 people. But still, like I said, some data is better than no data. And even if the numbers might not be exactly the same, I suspect when a larger sample is taken, a more authoritative sample, and especially in other countries, and clearly the important bit is going to be to see the numbers in countries that already have pretty high vaccination rates to see what happens. There's been an outbreak of Omicron in Norway, for example, in a Christmas party where there was someone from South Africa there, spread it to 17 people. They all apparently just had mild symptoms. Norway has a very high vaccination rate. It's spreading in the UK now. Recently today, the health secretary said that Omicron is now being transmitted through there is community transmission now. So it's out there. It's gonna keep spreading. But yeah, look at the numbers. This is the numbers for South Africa. This is the number of daily new cases. So you can see the spike is absolutely massive. But let's look at the deaths. There's still just no evidence whatsoever of a spike in deaths. This is still very early. We really have only been dealing with this variant for about 2 weeks. 2 weeks is still probably too soon to start seeing the death toll rise. But, some people do die in less than 2 weeks. So the fact that not even a tiny, tiny spike in deaths is evident so far is also further good news that it might not be as deadly. Now, some final thoughts. When we talk about how deadly a virus is, or a disease, how deadly it is, there's really 2 things we need to consider. We usually just think of the deadliness of a disease in terms of how many people it kills. And that's really, from a public health perspective, that's not really the main problem, because you can have a disease that is infinitely more transmissible, but less deadly than another one, and end up with way more deaths. And that's exactly the case with this particular type of coronavirus. We know of two incredibly deadly coronaviruses that exist. One is SARS, the other is MERS. So SARS has a mortality rate of around 10%, which is huge, way, way higher than COVID, which is something in the range of 2 to 3%. MERS has an even higher, it's basically 1 out of 3 people who catch MERS die. But why are these diseases less problematic? Because they don't transmit that easily. COVID is on a completely different plane of existence in terms of how easy it transmits. So as long as it transmits itself, massively around the world, that much smaller mortality rate still means more people are going to die. So that's why, if Omicron, if the transmissibility of Omicron far exceeds the advantage in terms of mortality that it might have, or rather disadvantage, being that it's less deadly, you can still have a very, very deadly wave. You can still have a lot of people dying. So this is why we need to really kind of focus on the issue of transmissibility and why that's still concerning. But insofar as the vaccines work, I think even if Omicron spreads, we should be okay. We should be okay. So in conclusion, that is why I think my analysis of this tends to be, I guess, a bit optimistic in the sense that, yeah, it's not great that we have a variant that is even more transmissible than already a fucking hyper transmissible variant like Delta. But if it turns out that it's less deadly, and it's spreading among populations that have some degree of vaccination, of immunity, then it might end up, in some respects, it might be a good thing, because it'll crowd out the slightly less transmissible but deadlier Delta, and that could be a good thing. So still don't know, very preliminary data. Once the WHO comes out with something, once the vaccine manufacturers come out with something, we'll have a better view of how much we should worry about Omicron. But as it is, I think if you are vaccinated already, I think you should have some reasonable suspicion that you will not get seriously ill. Although there is still pretty much a high chance that you might catch it. And even if you had Delta, there's still probably a very high chance that you can catch it. So, in conclusion, the obvious things that I say after every COVID video I make: please get vaccinated if you haven't done so already, and please consider getting a booster shot. It's been a while since your second shot, especially if you're in an age where you are more vulnerable to this disease or you have any other comorbidities. I would definitely say yes, get a booster as soon as you can. Do not hesitate at all. For the rest of us who are not in a that category of being particularly vulnerable, I would still think it's a good idea to get a booster at some point in the next couple of months. So yeah, that's all I have to say about this. When more information comes out, I will keep updating on the situation. But for the moment, I really don't think we should be panicking about Omicron, honestly. I still think the data does not suggest that this is going to be, another terrifying wave like Delta was, or when the original one hit. But we should also just, not assume that the pandemic is over. So take care of yourselves, take care of your loved ones, and if you like this video, please like, please share, and most importantly, please subscribe. I'll see you next time.